My name is Siobha Fuller. I am a care navigator for the Youth and Prevention Services Department. My pronouns are she, her, and hers. And I've been working on the union organizing committee for about a year now.
And my name is Brian Fleurantin. I'm a care manager in the health home program out of downtown Brooklyn. I've been with Housing Works since November 2018, and I recall joining the union organizing committee sometime in early 2019. Yeah, and I guess just to sort of start off a little bit, since I've been here, I've been really thinking a lot about how race intersects with labor organizing, because a lot of our workforce is people of color, and with people of color, like as we're trying to advocate for better labor protections, better salaries, better support, better insurance, mental health services, it's a very sort of an interconnected issue because our clientele is a lot of people of color, LGBTQ folks, trans people of color, and in our work, we see how these issues affect them directly, as far as like getting these supports, and for us as employees, having that same situation happen to us is very sort of like difficult to manage, traumatic in some points, very stressful and agonizing at times too. So for us, it's like we see it every day in how we work, the people we work with, the spaces we're actually in, traveling to work, all of these things. So it's like all of these labor issues are interconnected and it presents in various fashions.
I agree with the points that Brian made, and it is definitely something that I've been thinking about a lot over the past few weeks. I think it's not that it wasn't something that wasn't in the front of my mind, um, but sort of in this current moment, I was really thinking, well, if I'm going out here and protesting police brutality and things of that nature, and people in my organization and my organization is taking a firm stance against the NYPD in terms of slashing its budget, like, why why does this organization not practice what it preaches, in my opinion? Since the in terms of equity within the organization, I think it's really apparent to see who runs the organization and then who works for the organization. And then, as we've seen throughout the struggle we've had as an organizing committee, the real dismissal of the organizing going on at Housing Works, and how it kind of seems from the perspective of the executives of our company that we do not have agency as workers and do not have power as workers, and are being persuaded by an outside force to make a union at Housing Works, which is not true. And I think it's really apparent when I think of like the pay disparity in terms of what executives make and then what frontline staff make, and then the representation among the executives, which are mostly white men, and then the frontline staff, which are mostly people of color, queer people, trans people, women, and are being paid a wage that is just, for a lot of us, unlivable in this city. Um, Especially when you think about the housing crisis that is going on in this city as well. Um, yeah, it's just all very puzzling, and it makes it kind of challenging to do your job.
Yeah, and Siobhan made a lot of great points. And one thing I was thinking about a lot is that when I was out protesting, when I got back to work like a few days later, the company put out the email saying, they believe Black Lives Matter, they believe in, really promoting equality. And the thing I notice about it is they say it indeed, but when it comes to practice, as far as providing the actual tangible, measurable ways to support their, black employees, trans employees, queer employees, they don't really do it as far as like salary and in leadership. Like Javon was mentioning, the executive leadership it's pretty much cis white males, and that has a great influence to me. I think in how they've approached us. Like I can recall various situations where the head of the company saying, oh, these sort of like outside agitators, for lack of a better term, are like, almost like guiding the employees to say, "Oh, we want you guys to just do this," and not respecting our free will and respecting our decision to organize, go with the union that we chose, and really highlighting the issues that are important to us. And for me, as a black employee, there, it's frustrating because the leadership, like they say, they recognize the issue, but they're not really addressing it in full, and it's almost paternalistic in the sense where it's like, oh, you guys, oh, good job, we like that you're speaking out, all this kind of thing, but it's like you're not meeting us and addressing the issues that we have head on. And it's frustrating because it's almost like you're running into a brick wall in a sense where it's like every time you try to advocate, they sort of like, deflect, they delay tactics, they cause these big elections to be delayed, all of these things that come up. And it sort of goes against their sort of ethos of saying, we respect employees, we respect organizing, we respect these things, when it's a situation where people in your shop are directly organizing and speaking out to create a better work condition for ourselves, which will give us that sort of like inner strength and that inner power to continue doing that great work we all do in the community, which will then address these various issues that affect not just us as employees, but our clients and the greater community at whole across the 5 boroughs. And it's a situation where it's like, their words and their deeds aren't matching up at all.
Exactly. I mean, it's been really apparent from when we've been organizing. When I think of the fact that we are using the same tactics that they use and when they organize and when they want to achieve certain things, that I definitely agree with. I definitely agree with slashing the budget of the NYPD and funding healthcare for poor and minority communities. But when you see, they really seem to take offense at the fact that we collectively organize and we stage a walkout or come together and make demands. Once we use their own tactics, they seem to really go on the defensive rather.
Yeah. And one thing that I'm also thinking about is that they really position themselves as like progressive vanguards of organizing in the movement. And one thing about progressive politics is like you have to really respect the people that work with you and work for you. And if you're in a situation like they are, they really, I feel like sometimes they sort of like cloak themselves in activism when they're more like a corporate titan in a sense, where it's like they have all these institutional advantage, they have all this cachet, and a lot of their work is great, admittedly, and I'm proud to participate in some of the things that they do, but at the same time, it's like you position yourself as this progressive leader, you have to walk that walk when it comes to like the actual people that bring about the progressive change that you're advocating for. You have to meet us and work with us to achieve that goal. And I feel like as an organization, they're very lacking in that regard. And it's sometimes, frustrating when they come at us and they make it seem as if, we're the bad guys for organizing and advocating for ourselves and various other employees in the company. Is like, they're always positioning us as the bad guys in the situation while they're like, a mom and pop who's just like trying to do the best that they can with it. And it tends to be frustrating for us to experience every time.
Well, I know about the fact that Callan Lord has successfully organized to create a union at their workplace. I do not really know the specifics, but I imagine that if a union is possible at Callan Lord, it is also possible at Housing Works. And in terms of the RWDSU, which is the union that we are organizing with, that stands for Retail, Wholesale, and Department Store Union. It's kind of interesting because you see, a union that normally sort of works with retail workers, helping us during this fight. And, they also have successfully organized home health workers in, I think, Pennsylvania as well. And, it's just, it was basically we reached out to them, and they were one of the only ones who responded back to us and said we'd be interested in working alongside you in this fight. So that's why we chose the RWDSU. I really appreciate the way that they have validated all of us as workers in this fight, and have spent, a ton of time working with us.
Yeah, and one thing that I really appreciate about RW and their work with us is that they recognize that sometimes like this work is very intensive, it can be very draining, and they always provide us with that emotional support in that room to really give us that opportunity to explore our feelings and explore our spaces. In our groups, we have like staff support like once a week. We really have these things. We have like a little like a Zoom happy hour, so everyone can sort of congregate as a community. They really do a great job of making us all feel involved in the process. And I can speak from personal experience because I go to grad school, during the spring and the fall. And one thing I appreciate about RW is that they really if they notice that I'm burning out a little bit, or if the work is really too arduous, they always give me that room to be like, okay, you're working really hard. If you want to take a step back, it's more than okay. We've got your back. We'll pick you up as you need to, and they really provide that support, which I really appreciate a lot. It makes me feel like all the work I'm doing is validated, and working with like a great group of people, it makes the work more enjoyable. It makes it more rewarding, and when we do achieve our victories, it feels more satisfying as well. I think that, the thing to remember about sort of like connecting Black lives and labor is that, we're all members of the community. And, if we're in a situation where we're not receiving, the economic support, support as far as gaining access like mental health services, because our jobs especially because we deal with a lot of trauma, a lot of like secondhand trauma from our clients as they've experienced their things. I feel that in thinking about organizing in that fashion is we have to take like a holistic approach in a sense where it's like we think about the financial aspect of it, we think about the mental health aspect of it, and we just think about the community aspect of it as well. I feel like that's really a tie that binds the various movements and makes it as one, because especially as a Black person, dealing with the NYPD and just like having them in our community, and always feeling that one bad interaction may put you at death's door. It's very traumatic and it's very worrying to think about every time. And especially as I'm thinking about it, as we work to like really reform and change these barriers in these capitalist white supremacist institutions, we really have to keep a greater mindset of how do we go about making these changes while making everyone else that's advocating for a better tomorrow to feel safe. And I think that as we think about Black Lives Matter, and as we think about like the labor piece in particular, and I'm just thinking, I'm thinking randomly as the point that Siobhan made earlier about like the leadership. I think that leadership plays a big role in it as well, because if you have leaders that aren't from our direct community, that they haven't had our experiences, that aren't trans leadership, not Black women, not queer leadership, not Black men, all of these groups that aren't represented at the top of these institutions, the ideas that they come up with are always going to be in this one particular frame where it's like very white cisgendered focus, and you're not really as inclusive, as intersectional, and as expansive as you need to be. And I think that the beauty of Black Lives Matter is that it really sort of like pushes these institutions to think deeper. Think about how you go about creating a better tomorrow. Think about inclusivity, diversity, all of these various things. And it's very sort of intentional in how we focus on including more people, including more perspectives, and broadening our ways to sort of like think about what's a healthy solution and what's a healthy environment for everybody.
Yeah, and that sort of, I very much agree with what Brian said, and it ties a lot into what I was thinking of saying as well. And, I think that um, we want our leadership and the people who work for this organization to reflect the community that we serve and the populations that we serve as well, because it's really important to have that connection through experience with our clients. So when they're going through a difficult time, we don't just say, "Oh, I'm sorry that's happening to you," or "Oh, this is really difficult." To really say, um, I've been in similar situations as you. I know it feels like it's inescapable right now, but I promise you we'll get through this. And in terms of the leadership, it just doesn't look like the people that I interface with on a daily basis in terms of my clients. And in terms of the connection between this organizing movement and other organizing movements in the Black Lives Matter movement, I think it is so important for Black people to be paid fairly, and because when you actually pay Black people fairly, that then can disrupt cycles of poverty. And that is, sort of what we're at here. We are hoping for financial stability for the families of people who are working for this organization. And as well, I think it's really easy for us to sort of say, well, Housing Works stands for a great mission, so why don't you just sort of toe the company line and, not make the organization look bad or anything like that. And, as I stated earlier, Brian and I both wholeheartedly agree with the activism direction of the organization. Like, I go to many protests, but at the end of the day, we just want Housing Works to really heed their own message and to treat us as individual workers, as whole people, and people who deserve to be able to make a living in a very expensive city. And as well, I think it is really unfair to what is that? I think it's really unfair to expect workers to accept an exploitative role for the sake of a mission. Because I think that's contradictory to the mission that is being set then.
Yeah, and one thing I'm thinking about also is, like Siobhan was saying, as we address generational poverty, and as we sort of provide employees that support, where it's you don't have that sort of financial anxiety that sort of cripples you, especially in New York City, where everything is as expensive, and with the city making all of these cuts, we wouldn't have access to services as well. So with if for our employees that have kids, not having summer youth is a very big burden. Not having schools open, and that's really going to be taxing, especially when you consider that kids are going to be home all the time, and you may not be able to afford a sitter, or if sitters can even come due to COVID. Everything is sort of interconnected, and by addressing the financial piece of it, they'll really be doing a better job of really addressing our needs in a deeper, intimate way. And one thing I'm thinking about also that Siobhan mentioned is, Housing Works. Like, they have this great progressive reputation, and I think that sometimes it's a moment where you sort of rest on your laurels, so to speak, where you've done this great work. You guys did the die-ins, you've done the trips to Albany, you fought Medicaid cuts, you've done all of these great things, and they're greatly appreciated. But that's not almost like a situation where you could just say, okay, I've done this thing because I've done these great things in this one arena. It means that I can sort of slack off when it comes to treating my employees in a fair fashion. So I think the great thing about labor organizing and the work that we've been doing in the union is just really pushing them and challenging them to live up to their ideals, live up to their mission statement, and really go about being the leaders that they say they are, and sort of following up in the work that they've done in other arenas. Bring that same energy to what we're doing as we advocate for better conditions in the workplace.
Yeah, Brian brings up another great point that I've been thinking a lot during this time, is, the working mothers who work for our organization. And right now you can't really put your kids in childcare, and you have to deal with having a very stressful 9 to 5 job where you don't feel like you're paid enough and have to deal with screaming kids all day. I mean, it's shocking that people aren't already ripping their hair out. And, it's very interesting. The difference between we have execs that are working mothers and frontline staff who are working mothers, and the difference in the experiences that they have had during this pandemic is just so illuminating. If you want to have women in the workforce, if you want to support them, then you need to provide them with enough money so that they can subsidize their childcare.
Yeah, and one thing I'm thinking about a lot is I was talking to a friend of mine when I was in the office a few days ago, and he mentioned, he's a frontline worker. So he's been in the office. Like, luckily for me as a case manager, I have a bit of privilege in that I can work from home pretty much every day and still be able to do a lot of my job competently. But for frontline workers who are in the clinics every day, who are really front facing more than me and Siobhan are in our particular roles, they're really in a situation where they're interacting with clients. They're traveling back and forth across the city, and when they're in the work environment, it's a situation where they have to almost scramble to get the most PPE equipment, really getting that support in. And one thing I was talking with him about is, they're saying that, oh, we appreciate you, thank you for all your service, but it's not being reflected in the area that matters a lot, which is the finances. Like, you're in a situation where you're doing this essential life-saving work for the community, and management is not really reflecting their sort of like their stated appreciation and the financial aspect of it. It should be a situation where if you're a frontline worker, especially, like, we're getting all the praise or all, like, the press releases saying, oh, you guys are doing such great work, we love you guys, but you're not, as an organization, reflecting that love and appreciation in our paychecks. Because, if we get sick and something happens to us, our families are going to suffer as a result. And then as a company, you'll just plug somebody else in the role, and our communities will have to, like, sort of scramble to sort of, like, pick up the pieces of the person that's ill, or God forbid is no longer here anymore. So I think that as the company really, as they really navigate COVID and just, like, the future that's coming for us, they need to do a better job of providing that financial support for direct line frontline workers, because they're really doing all of the heavy lifting to keep the community upright, keep the organization upright, and making sure that the people that we service as clients, they're getting everything that they need, and they're not suffering any sort of, like, fallbacks or gaps in treatment because of all the sort of, like, institutional chaos that's coming from administration.
Exactly. Frontline workers do not need to be called heroes. We know that it is very courageous to work during a pandemic. They need hazard pay, is what they need. They need to be paid. It's really interesting. Housing Works is really always focused on growth and expansion, and it really comes at the cost of the workers and the care that we can provide clients. When we see them participating in these mass distribution events for frontline workers at other agencies, it's like, well, like, where was our PPE in the beginning of this crisis? When I was like, when the onset of the epidemic was first sort of starting, I was still coming into work, and there was like, it it was like the execs and the people running the organization were caught like a deer in the headlights. Like, there was just no protocol. Everyone could come as they want. And we weren't provided with masks or gloves or anything like that. Only after we saw things really become serious is when, they started to step up to the plate a little more. And I'd like to say as well, sorry, that amongst my friends, I was one of the last people physically going into work.
Yeah, and one thing I like to add on to Siobhan's point is, especially in the initial stages of COVID, there really wasn't much of a plan as far as how they communicated with us. So it's almost been a situation where they've been, like, winging it as they go along, as it relates, like, policy changes, certain standards that they want to meet for the state as it relates to funding, all of these various changes. And us as employees, we've rolled with every punch thrown at us, and we've continued to do that excellent work. And it's always from from an institutional perspective, they're always throwing a new thing at us. And as employees, we're always making sure that we sort of like, keep up with the Joneses, and we always make sure that we're doing the great work that we continue to do. And I think that it should be reflected more, not just in addition to our finances, but making sure that you're not laying off case managers and like really like dropping clients in like the middle of nowhere in the middle of coverage. Like I can attest in my shop, they furloughed employees and nobody had a clue as to what happened with their clients, as to who would be taking care of their care coordination, connecting them with services, all of these things. And as a company, when you just sort of like furlough people and don't really communicate as to what led to the furlough, as to why they were furloughed, or as like what standard made it so that way our colleagues are no longer here, it's deeply frustrating to experience as a worker. And I think about it from the client's perspective. I've had plenty of clients, as an example, like, providers change all the time and there's no notice. We just have to sort of like figure out every time, oh, there's a change here. We try, hey, man, our hands are tied too. I'm sorry, I can't explain why the doctor isn't here anymore and why there wasn't any sort of notice. So I think that bringing it to a labor perspective, I feel that as with the union and as we continue to push them to do better, we can really get greater accountability and transparency from administration as to what their policies are, what their decision making is as far as like employee safety, maintaining providers, making sure that all of us that are here and busting our butts to do the best job for our clients, that we have the full support that we need so that we can do an even better job than the amazing work we're doing already.
Exactly. I was speaking from personal experience in terms of the work that I've been doing in this past month and rolling with the punches. I'm a care navigator, so normally I would have a care manager who is overseeing my role in helping me with client coordination and making care plans and things like that. And right now, I have been without a care manager since the beginning of the month. And I just recently learned that my new care manager is going to be starting in the middle of July. So it's been a month and a half that I'm just like working on a caseload by myself, basically, without the experience of being a care manager.
Yeah, and one thing I like to add on to Siobhan's point, as a case manager, I have my caseload right now is like 47 people, and with the care navigator role, it's like you almost have two like gigantic caseloads you're juggling on each side. So without a case manager, it makes the work even more daunting because you have to grab onto like as many people as possible and provide those supports. And from my role as a care manager, I've had a lot of like focus on, oh, you got to get the right metrics, you got to get data. Meanwhile, the actual work that we're doing is almost unappreciated to a degree, because it's a lot of focus on, oh, you got to hit this sort of like data benchmark, so that way the state doesn't come chasing behind us. A lot of the discussion that we get from like administration focuses on that to a great degree. And for us that are working to actually like really provide these great supports for our community, it's a situation where administratively they're way more interested in like hitting a billing benchmark as compared to like us connecting people with like services, getting them doctors, therapists, housing if we can make it possible. All of these things that we're doing in our roles as care managers, care navigators, patient assistants, all of these roles, patient care coordinators, all the things that we're doing, it feels almost unappreciated and unnoticed by administration when they put all of their interest and focus in like their meetings with us, all these things, on just like numbers. Like that's really where the company really falls behind. I've had a few clients pass away. Yeah, I've had about, I want to say, three clients pass away in the past couple months. And one thing I appreciate about my supervisor is that she gave me room to like have an opportunity to like debrief and really like decompress when it came to it. Like with my immediate supervisor, she's really fantastic, and I really get that support when I need it. And from there, I've in moments like that, I just try to really like think about all the good things about my clients and really just make sure that I remember all of the great things about them, so that way, even though I'm sad in the moment and I'm very sort of like depressed about the person passing away and the and the effects it has on their family, I try to think about all the good things about them as well. So that way it feels like, you get to really appreciate the person as you remember them and as you communicated with them.
I haven't lost any clients, thank God. And I also have not lost anyone in my department or any of my former colleagues. So I'm very thankful for that. Yeah.
One thing I've noticed since I've been here is that a lot of our focus has really been on billing and bringing money into the organization. Like that's really been a lot of the focus as far as, especially when it comes like, admitting clients and we're still short case managers. So it's always going to be a situation where it's like, like even as cases close, like more coming in like pretty much every day, and more people are coming in, like more because I think it ties a lot. I think the stressors of New York City work particularly well with the nonprofit industrial complex, and that it's almost like an endless trough where you're always feeding it and feeding it and feeding it and feeding it, and it's a situation where even as staff, as we're like really burdened to the top degree with like our gigantic caseloads and really trying to like fill in as many sort of like supports as possible, it's almost never ending. And as a company, they expect us to almost do more with less in a sense, whereas like one case manager has like 45, 50 clients, some close to 60 clients. And if we don't have the care navigators as well, like when they're short, or in Siobhan's situation where she hasn't had a case manager in a month. So it's like she's doing the intense case manager work, but it's not reflected in like the salary aspect of it, and that's very stressful and draining. It's almost a situation where we're all doing like Herculean work, but it's like, oh nope, that's not enough. Got to do a little bit more. Got to put like 5 more pounds on your shoulders. So it's a situation where just the particular beast of a nonprofit and always needing to bring money in, combined with like the various like stresses and inequalities that are particularly unique to New York City. It may be a little bit more in some other places, but I feel like New York is its own particular beast in that fashion. All of those things are combining together to create a perfect storm of like employee burnout and just employees really having to do everything imaginable. So always try to support these folks that desperately need us, while also trying to navigate just the various like stresses of having so much work to do in just an 8 hour day. I'm thinking about I'll use myself as an example. Like, and I knock out a lot of work, but it still feels like some days where it's like, man, there's like so much more I need to do. And it's like that a lot. We're doing a lot of work, but it's like that. It's like a mountain where we think you're at the top of the mountain, but you have 500 more feet to climb. And it's like that every day.
Exactly. I really think it's a mixture of both. I think it is a flawed system to begin with, and then it also has some bad actors to go along. Because, I mean, as we said earlier, there are other organizations like Housing Works that do have unions. So it is possible within this system to have a unionized force of workers. It is just also that the executives at this organization are really pushing back hard against us. And, I was thinking about this earlier about, the fact that the things that Housing Works doesn't have control over is, what our funders are saying in terms of Medicaid, and in terms of, I personally work on a grant that is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration. So it's the federal government, which is also really interesting because I'm in a position that's funded by the federal government, but I don't have the protections of a federal worker or the salary of a federal worker. So, in terms of that, we have these goals that we're supposed to meet called deliverables. So you're supposed to get this many people signed up on PrEP, this many people enrolled in the undetectables, things like that. And, if you don't reach these goals, then your funding might be taken away. And then you can't help your clients if your funding's taken away. But, the sort of nature of these deliverables doesn't reflect like the work that I'm doing with my clients that falls outside of those very set in stone goals. Obviously, if my client is starving and needs food, I'm going to find a way to find them food before I get them enrolled in PrEP. and there's no deliverable that goes to show, oh, I like got a client food, or I went to the pharmacy to pick up their medication, or I went to a doctor's visit with them. That's just not, these funders don't really seem to have any sort of appreciation for the work that is not those solid goals that they set.
I came in I came in 2018, so I came in like right in the middle of the current administration. And one thing I think about is, especially like Siobhan mentioned with like federal funding, like this current administration is so antagonistic towards social services. It continues that sort of like great tradition of like, really despising communities of color and nonprofits and just like, local community initiatives. Like it's in tradition with that. And one thing I think about especially is, with housing, with the federal housing cuts, and you combine that with, really the antagonism towards the Affordable Care Act, and all of these like federal initiatives and sort of like, edicts and sort of like, direction from the federal government, that really sort of manifests itself in state and local government. And it really serves as a deadly sort of like brew of like various toxic factors, and it makes the work really more challenging and difficult to navigate. And I'm thinking that as time progresses on, depending on what happens in the big elections coming up, what will really shape the work and the communities that we're in going forward, and possibly permanently in some degrees. Because especially if there's like, because in our work we see how important housing is. And if housing is continuing to be gutted, it makes a situation where the community is going to suffer even more, and that's going to have lifelong generational effects on various communities.
Yeah. So Housing Works was my first job out of college. And I graduated college while Trump was president. So I have not experienced work before President Trump. And I think yes and no. As Brian mentioned, funding is a key component. Um, I think with the leader that we have right now, I think the way I mean, it's harder to feel like in New York City particularly, but the way that he phrases things and the way that he enacts policy translates into violence for the most vulnerable within our communities. And particularly, I think of the epidemic of violence against Black transgender women in the United States. I work on a grant that is that deals with transgender people of color. That's the population that I work with, and you know, um, it's hard not to worry. It's hard not to spend your whole day worrying and thinking that something awful could happen to one of your clients, because they don't disclose their what's going on to their sexual partners, or they're involved in survival sex work, or things of that nature. I try to give the girls that I work with some sort of general rules to adhere to like keep themselves safe, and a way to hopefully practice harm reduction. But um, it's not foolproof. You can be a Black trans woman, you can be a trans woman and live your life by the book and still end up being murdered. So as a social services provider, in terms of making sure that my clients are safe, I can't do all that work by myself. Like, I have to wait for the world to become a better place for them, and it's hard. It's really hard.
Yeah, and just to add on to Siobhan's point, that safety part is so important. And I think that especially with the rhetoric that comes from like the federal government and the current administration in particular, like various vulnerable communities are at even greater risk. Like, I think about like, trans women of color, just like, just just the various dangers that they face on a day-to-day basis, and when you combine that with a federal government that is hostile towards just their general existence in the sense too, like that general danger and the particular unique hostility that comes from like the federal judge from the federal government, the court system, police officers, all of these unique dangers are combining together, and it makes trans women of color even more at risk for discrimination, bodily harm, self harm. All of these things are combining together in this moment, and it's very concerning. And I feel that as sort of like we push for like a better tomorrow, as we censor trans women of color and trans women in general, just to broaden out a little bit more, as we censor them and make them the leaders of various movements, we I think we'd be creating a more inclusive, diverse movement that's safer for everybody involved. Because when you protect the most vulnerable people, everyone else benefits as a result.
Exactly. And, it's definitely not the most, a lot, I think for a lot of my clients, they're more worried about housing and getting food and making sure that their meds are all in check. But, the fact that really every month, every week, we hear something from this administration trying to dehumanize trans people. It has a profound mental impact on me as a social services provider and a trans woman, and all of my clients as well.
I've had clients who had various sort of interactions with law enforcement and the sort of correctional system broadly speaking. I have a few clients that are on parole, a few one that's currently incarcerated, one that was recently arrested, and one thing I've noticed about all their various experiences is just like that fear that sort of like grips them, like fear of being reincarcerated, fear of being having their parole violated by a PO who's not really sort of like open to understanding like their health conditions, various things like that. So I think that especially as we think about law enforcement and just like police brutality and just like just a sort of like surveillance state to broaden out a little bit more, as we work to sort of like deconstruct these systems, really making it so that way the carceral state isn't as gripping as it is right now. That's a huge part of all of our work. And as we sort of like defund police as a concept, really work to break the sort of like prison industrial complex on its own right. As we do that, we're making our lives better for our clients and the greater community as a whole as well. So I think that as we march and as we think about liberation, thinking about how to like really break the carceral state is a huge part of it, and one that's incredibly hard, but it's an incredibly worthwhile challenge at the same time.
Yeah. I also have clients who are formerly incarcerated as well. And when it comes to the experiences of transgender women in prison, it is so incredibly traumatizing and awful. There are many examples and instances of transgender women being held in men's prisons and repeatedly being sexually assaulted, and those guards really don't give a shit. Um, and it really just demonstrates to the degree that prisons are not made as a space for rehabilitation, which we all know to be true, and yet they still exist. It is a place where we put people that we want to hide. So we want to hide people of color, we want to hide trans women, we want to hide queer people. So we're going to, find them with, a dime bag of weed, and then they're in prison. And when it comes to thinking about how, and then, we also think about the example of Layleen Polanco, who was held in Rikers, and died in Rikers, because, the guards really, did not. It's so like mind-boggling to put into words the cruelty that Layleen faced in prison, in terms of the severe neglect that she got, placed in solitary confinement, which really shouldn't exist. I mean, um, it's so hard to make like this sort of corollary, but a lot of us have noticed how difficult it is during this time to not be able to leave the house, and it has had a profound mental impact on a lot of us. Think about, like, you can't leave the house ever and you're alone and you have to deal with like guards and surveillance. Like, we don't have to deal with any of that, and all of us are ready to like lose our minds. So when Laylene is placed in solitary confinement and has a medical condition where she needs to be under constant surveillance and make sure, like, constant surveillance in terms of having a medical professional there, not a guard, and then the cops laughing at her in her cell, and taking an hour and a half to get a medical professional into that cell after she had been unresponsive. What are these people being paid to do if it takes them an hour and a half to like deal with an emergency in a medical sense? And I think that the vast majority of my clients really don't trust cops, because what the fuck do they have to trust in the police? They are Black transgender women, Latinx transgender women. The only thing they associate with the cops is being harassed on the street by them. Probably, being solicited by them and not being able to say anything. In so many states, cops can have sex with inmates while they're being detained, and there's no repercussions for that. So, I mean, it just really demonstrates when it comes to Laylene's case, and then so many other cases, that transgender women of color have nothing to trust in the police in this country. And when so many people have talked about their experiences and have died at the hands of these agents of the state, I mean, all the time we think of, if we acted in that same way in terms of our conduct when we were in a professional setting, if any of us killed someone at our workplace, we would be tried for murder and we wouldn't have a job. So why is it so difficult to, have adequate punishment for the fact that they are taking away people's lives?
One of the great things about organizing is that is really made us even more inclusive as a community of housing works. Like, as we've organized and as we've worked to build a union, we've really managed to connect out various people who may not have day-to-day interactions. We're all coming together under one common cause and really building out that camaraderie, that solidarity, and that greater sense of community. Like, that's been really sort of important, and I've been really thankful for that experience as I've been here and as we've really gotten deeper into the labor organizing movement.
Yeah, I'd love to echo that and say that, yeah, I mean, one of the best things about working alongside my coworkers and trying to make this organization better and to actually serve the people who are doing the work and not the people who are organizing the work that we do. One of the great things about that is the connections that I've made with my coworkers. I knew Brian a bit before, but we've definitely gotten to know each other a lot better while we've been organizing alongside each other. And, we've had a lot of great moments, a lot of great breakthroughs with people that we work with. And, just always want to reiterate justice for Laylene, and that transgender women of color should not walk the streets and fear for their lives. And we must create a world in which we stand up for transgender women of color.